And so I pivot to this right here because I think that it is important. We couldn't have done all of these things without our tremendous and extraordinary help from our residents. I mean, a lot of the things that you see right here that we're able to achieve is truly the result of a team effort. And just like any team, you know, a team is only as strong as its residents, and couldn't be a better illustration of how strong our team is than having Dr. Clifton give his last talk as a resident. I think that this is why it's so appropriately called 7 years in the making, because all the stuff that you saw, the stuff that Jose talked about, the clinical trials, the work, the visiting professors, the recruitment, is really a true testament of the work that our residents have put together, of course. And our residency is young, and now with Dr. Chaichana and Dr. Chen at the lead, we're trying to grow our residency, working diligently. But Dr. Clifton truly illustrates that principle of how important the residency is and the role they played in the last 4 or 5 years in making our growth in all three shields skyrocketed. I mean, you can see his qualifications, his BS at the University of Central Florida, and then he went to medical school, South Florida, and then he stayed here. He was a #1 pick, and a lot of places around the United States decided to stay here with us, and for which we have been extraordinarily grateful. And now he's going to go and do a adult and pediatric comprehensive spine surgery fellowship at the same place where Mark Pickelman was a fellow, and the same place where Ian Buchanan is finishing his fellowship right now, which is considered honestly the premier fellowship program in the world as far as complex spine surgery is concerned. And it is a combination between orthopedic surgery and neurosurgery. Bill has gotten, Dr. Clifton has got an extraordinarily large number of awards. Actually, the last thing that we're gonna see from this year is gonna be, he's gonna be featured again in the Mayo Clinic Alumni Magazine. There's an article that he and Dr. Chen are correcting right now. He has been a recipient of multiple awards. You can see right there, the alligator tank, the work that he did just recently last week. I saw that one of the patents he submitted, it was now licensed to a major company. We have thousands of dollars coming into our department to support further our work on research, thanks to the extraordinary work that he's done. He's already at a very young age. You can see his age index. My dogs are getting very excited right here. You can hear them in the background. That was actually Rocky. He knows that Bill is extraordinarily fit, so he wants to be part of the training camp probably right here. And not only fit physically, but mentally. You can see his age index of Dr. Clifton, a tremendous accomplishment and a testament of his work. So Bill, I am going to yield I'm going to stop sharing. I'm going to yield the platform to you, and beautiful work. We're very grateful for all the years of dedication that you have had in our service. And you can see a lot of people logged in today, over 75 people from all over the world. And we thank you for a tremendous dedication to our patients. Take it away, Bill.
Thanks, Dr. Q. And I don't really know where you got that picture of me in the 3rd grade to use, for the flyer. I actually look good in that picture. That must be before I started taking call.
I was going to take some of the Instagram pictures, but I wanted to be respectful of the Instagram pictures. Yeah. You know what I mean? But you heard Rocky. He was getting excited.
See if I can share my screen here.
Yes, we see it. Perfect.
Okay, perfect. So everyone can see that?
We see it, but we see the two, the big one and the little one. I don't know. It has to do with, it has to do with the way that you're showing it probably.
Well, let's see if I can figure this out real quick.
It's there in display settings. You just have to.
It's because you have the dual monitor and you are sharing the
oh, there you go. There you go. Perfect. Now we see it perfect. It's
all
perfect
right.
now.
People trying to teach me how to use technology. I see that. All right. Well, thank you, Dr. Q, for giving me the opportunity to basically give my graduation speech, since we're not doing a live graduation this year, which on a side note, I'm pretty happy about, because I don't really like, big hoopla. So this speech is called 7 Years in the Making. It's really geared towards the medical students, residents, and fellows that are here on the talk today. And what I want to do is kind of give everybody a perspective on, what neurosurgery residency is like, and then also my personal experience. And then just give everybody a chance to reflect on why we got into this business in the first place and why we do what we do every day. So let's see if we can advance here. So disclosures, I have a royalty sharing agreement with a company called Simjury for some of my 3D printing stuff. I'm not going to be talking about it in this presentation. So just to break down today's talk, we're going to go over neurosurgery training in a nutshell, my personal training and my experience in neurosurgery residency, and then just some pearls and thoughts for the residents. So at the very beginning of everyone's career, there's this moment and an inception that you see something or do something and you realize this is what I want to do for the rest of my life. And I think everyone that gets into medicine in general, not just neurosurgery, remembers that specific moment. And that fuel and that fire that you have for whatever happened really propels you through all the hard times, and all the challenges that you're faced with your training. And I think that we don't think about that moment as often as we should, especially the further we get away from our training. So if you think about your timeline in a career, there's a small portion in your life where you figure out, what do you exactly want to do? And then there's a little bit longer portion of learning how to do it, but the actual doing of it is what you're doing for the rest of your life. And the decisions you make during this time period has a huge impact on what you do for the rest of your life and how you are going to do it, and even the ability to be able to do it. So if you take that in context of neurosurgery residency, neurosurgery residency is broken down into 7 years. And some pictographic representations of each year. You come in your intern year, you really have no idea what's going on. You've never seen anything before. You feel like you're completely lost. And then around PGY 2 or 3, you've seen enough cases and done enough cases where you realize, okay, I think I'm starting to get the hang of this a little bit. And then on your PGY 4 year, you realize that you're never going to leave this island and you're not even halfway through your residency. And then 5 and 6 is mostly broken down into elective years and research years. So you're pretty much absent from the swing of things. And then in your PGY 7 year, which is where I'm at right now, you start looking for jobs and you have a completely different perspective about not just learning how to do the procedures technically or how to treat the patients in the operating room, but also about what kind of practice you want, what's the rest of your life going to look like, what kind of job are you going to have, where are you going to live. And that's really the longest portion of your career. It's not this training part. It's these decisions that you make that lead up to that. And this is an actual picture of Eric Nottmeyer in Atlantic Beach that I found. I don't know who to give photo credit to, but it's an impressive picture. So, a pictographic representation of me, this is me about 10 years ago on my first day of medical school. That was a very expensive toupee that I had back in the day. And then if you focus about 10 years later, this is me now. Just my mom had sent me this picture a few weeks ago, and I was passing it around because, not only am I giving the smolder, but, you just realize how young and impressionable and enthusiastic I was to put on that short coat and go in the hospital. And then you think about 10 years later, just that short amount of time and what you're able to do now in the operating room, and the gravity and seriousness of what we do, really hits you. So just to go over my training in a nutshell, as far as patient care, I directly provided care for about 5,000 neurosurgical patients in my residency. About 50% or 55% were spine, and 45% was cranial. That's a little bit higher than national average for cranial procedures. It's usually about 60% spine, 40% cranial. And I put in about 7,000 pedicle screws. For research, I have about 70 publications, 40 were first author, and then we talked about the patent that I have. And that's what I was able to accomplish in 7 years. And the reason why I'm putting this on there is to highlight for the residents that are here now, how amazing our program is. If you think about how much we are able to do and the early operative experience we get and the opportunities like Dr. Q was showing through all the highlights of the research opportunities, the visiting speakers, the doors that are open for you at such an early stage in your career, it's really been quite amazing, especially talking to some of my other friends who are graduating this year and haven't done nearly as much. And, I would say this is a true testament to Mayo Clinic and to the leadership of our department in giving us the opportunities to succeed. And then now I just want to focus on my chief year, because I really feel like this past 12 months has been the defining 12 months of my entire career and in some ways my life. So how they break this down for you here at Mayo Clinic is really unique. So I would say at 90% of the places, at least from my friends that are graduating right now in neurosurgery residency, chief year is just a continuation of your residency. You're still taking call. You're probably doing a little bit more in the operating room. You have some teaching responsibilities. But here, what they want to do is give you a taste of what it's going to be like outside in actual practice. So they have you credentialed with Medicare for billing privileges in the office. You have your own outpatient clinic, so you get to see and work up patients and decide who needs surgery and who doesn't. And then you get an extraordinary amount of autonomy in the operating room to do your own cases, make your own surgical decisions, operate yourself out of complications. And honestly, I think this is unique. And I think I can only think of one other place that used to do this and I don't know if they do anymore, which is UF, but the ability to practice these things before you're actually on your own is really unparalleled. So for my chief year, I saw about 200 new outpatient consults in clinic this year. That's not including follow-ups and repeats from last year. I've done 342 cases so far in this year. 60% were spine, 40% were cranial. 80% of the spine cases that I did were multi-level fusions and revisions. They weren't 1 or 2 level cases, nothing really straightforward, which really allowed me to propel in my surgical skill and get me ready for my fellowship that I'm about to go do. And I had the opportunity to operate with every faculty member, which is a huge privilege. I've talked to some of my other friends who are graduating and they're not able to do this. So having the opportunity to learn from so many different people and see how to do things so many different ways was really an incredible blessing this year. So I just want to talk about some lessons that I learned this year. The first one was billing practices. Learning how to properly bill, learning the business side of medicine was basically like starting residency all over again. It was trying to figure out not only what's fair for you and what's fair for the patient, but also how these policies are put into place and how they're made and how they're maintained. The other thing is dealing with complications. When you're a junior resident and you tear the dura or you put a screw in the wrong place, the attending's there to fix it for you and to yell at you for a little bit. You feel bad for a couple of days, but then you get over it. But when you see a patient in the clinic, you look them in the eye and tell them that you're going to operate on them, you're going to do their surgery, and then you have a complication. You have to see them, not just in the hospital, but at every single follow-up appointment, look them in the eye and realize what you did and how it affected their life. And learning how to deal with that, not just on a professional basis, but an emotional basis and a personal basis was really difficult. And it was something that I was so grateful to have senior mentorship here to be able to talk to you about it and be able to help me through it. And not just in watching me do that and telling me what to do, but also in sharing in their experiences. So relying on the expertise of people with more experience than me was really quite incredible. And then this is something that we all do. And I know there's a APP workroom right now filled with people laughing because this is really what they do for us every day, is dealing with these difficult patients, how not to get angry, how to be forgiving of people who are hurting and broken, and how to communicate with them in a way that you reach them at their level. Work-life balance, there's no such thing. And I put that there for a reason. What we do demands 100 hours a week, no matter what residency program you're in or what ACGME restriction. And not just personal time in the hospital or physical time in the hospital, but also emotional and mental time of going home, reflecting on what you did, thinking about your surgeries, and as my wife tells me, being present at home, which is not just being physically present, but being mentally present as well, and learning how to just let stuff go that happened at work and live in the moment when you're at home. And then this was my favorite thing about this year, was finding enjoyment in my practice. The first 6 months of chief year were really hard, trying to figure all these things out that I've already talked about. But then once you realize that this is just going to be the rest of your life, and then you find a rhythm and a balance on how you're going to do it, you really find great enjoyment in seeing patients, working them up, seeing them do well for the most part. And you have this joy about seeing them in your post-op clinic. And that really gives you a sense of what the rest of your life is going to be like. So there's just some personal reflections. This is now going a little more touchy-feely just to the residents. These are the things that I found that really matter in residency, in life, is number one, patient outcomes. How your patients do and how your post-op clinic is going to determine your attitude, not just towards new patients, but also the people you work with and the people you see in the hospital. And Dr. Nottmeyer was really the one that showed me this, and I was able to spend a lot of time in clinic with him. But your patient post-op clinic should be the happiest day of your week. And he always said that. And his was, because he's an incredible surgeon. And I've grown to understand that too. Building relationships with your patients, with your coworkers, with your family, that's something that really matters. And you can't throw that aside just because you're learning how to do something new and something difficult. And the last thing is definitely the most important thing, loving what you do. You have to love what you do, because there's going to be times where you're not going to like what you do. But as long as you love what you do, that will get you through those difficult times. And then these are the things that don't matter. So numbers games. It's easy as a junior resident to say, oh, I did 100 of these, and I did 200 of this, and I published this many papers, and I did all this. Those things won't matter in the long run. Bad reps are bad reps. You can do 100 cases the wrong way and you're not going to get good training. You can do 2 cases amazing, and then you're going to get better trained than if you did more. The second thing is status. And status and worrying about what others think of you kind of go in the same line. It's very easy in our profession to get on a step stool and say, okay, I'm on this rung, and then this guy's on this rung, and I'm going to try to bump him up here to get to here. Not only because it's a small field, there's only about 3,000 neurosurgeons in the United States, but also because there's a lot of pride in what we do. And there's nothing wrong with that. But if you make that into the main focus of your life, about getting ahead or worrying about what the next guy thinks about what the cases that you do, you're never going to be happy. So just to reflect on this a little bit further, your patient outcomes are determined by patient selection, number one, knowing who to operate on. The second thing is knowledge of anatomy. When you're in a case and something's difficult, if you understand the anatomy, you can operate yourself out of any situation. And then also reflections on successes and failures. So, there's 2 sides to the spectrum. Everyone comes in with 2 different things. And this is something that I learned from Dr. Pickelman, was there's a group of people that come in that are self-flagellating, that only think about things they do wrong and that they're afraid to do anything. Then there's the other group that comes in that doesn't care, that can put everything aside and just keep plowing no matter, what complications you get or no matter what kind of problems you have in your practice. And somewhere, hopefully by the end of your residency, you kind of meet in the middle and you find this balance between one or the other. And I think that really matters on how you reflect on your successes and failures in the operating room, in the outpatient setting, and in your relationships that you're building. And Dr. Sant used to say, every Saturday is for reflection. So you should think about the successes and failures of the week to get you ready for the next week. Building relationships. Talked about building relationships with your patients, and not only with your patients, but also your patients' families. Sometimes our patients can't communicate with us. They can't appreciate or understand what's going on with them. So your point of contact for describing what's going on is going to be their families. And how the patients do not only affects them, but it affects their husbands, affects their wives, affects their kids. It can affect an entire dynamic of people. And taking time to talk to the families, explaining things 2 or 3 different times to 6 or 7 different people is exhausting. It adds hours to your day, but it really matters to them. And it affects their life in a way that's very intimate and special. And also with your coworkers, it's easy to work with somebody 100 hours a week and get really sick of them, and they become almost like a sibling or like a spouse that you're really not married to. But learning how to appreciate their strengths, learning how to respect their weaknesses, and learning how to communicate with each other is very important, because we do spend more time here with each other than we do at home. And the last thing, loving what you do. How to love what you do is to have passion for the nuts and bolts of your job. So it's not just the idea of what you do. It's not just going into Publix or Walmart and being like, oh, I'm a neurosurgeon, like I'm the man. It's enjoying coming into work early, putting in the EVD in the middle of the night, seeing the patient that's really difficult, that has back pain and is super fat and doesn't need surgery. The little things that we do every single day that make us what we are, we have to enjoy those things. Because if you don't enjoy those things, you'll never enjoy the result. And enjoying the journey, not just the destination. So there's always parts to cases that we don't like. There's always parts to jobs that we don't like. But as a whole, as we're going through it, we have to be able to enjoy that part, not just where we're trying to get to. That was really hard for me in my junior years, is trying to figure out, how do I enjoy being a peon, not knowing what I'm doing, getting yelled at all the time by people that know a lot more about this than I do, and just feeling like an idiot. But looking back, the decisions that you make during that time, when you're at your most vulnerable emotionally, when you're feeling that sort of loneliness in your job, when you're hungry and tired, and all the things that you're supposed to do when you're not making, life decisions, those decisions that you make affect the rest of your life. They affect the destination. So for the residents right now, for the medical students right now, for the fellows right now that are going through this, enjoy what you're going through. That type of pain is fast and it's rare, but if you love what you do and enjoy it, you'll get to where you want to go. And also having a scientific curiosity about your job and what you do every day. Before Dr. Q came, I really wasn't into the whole research side of things. I didn't understand it. It was kind of one of these mystery things that I didn't think I would ever really understand or get. But he opened it up in a way that showed me that collaboration and having just a passion and a curiosity for what you do every day leads to awesome research. And it also leads to big research in numbers. So if you think about the other things that are important that we get thrown out a lot at us, especially by administrators or things that we hear, like practice growth, RVU, salary, NOI, patient referral, case volume, operative speed. If you focus on these things, you're never going to be happy and you're not going to achieve your goals. But having good patient outcomes leads to better practice growth. Knowing your anatomy helps with your operative speed. Reflections on your successes and failures helps with your case volume, growing your practice. Building your relationships with your patients and your family, more referral. Loving what you do, you're going to be faster. You're going to have more RVUs. You're going to have a better salary. Your NOI, your net operative income, all those passion things, those things will happen as you focus on the things that actually matter. But this is a one-way street. If you're worried about your practice growth, then you're not going to build good relationships. If you're worried about operative speed, your patient outcomes are going to fail. If you're worried about case volume, then loving what you do and having a passion for what you do is going to die. So this is definitely not reversible. And once you understand the things that matter and how you put them into your practice, all these other things will happen to you. So here's a few more phrases not to take literally. So the only way to do this is, there's a lot of different ways to skin a cat. There's a lot of different ways to do things. And my advice to the residents is learn as many techniques as you can from as many people as you can. And even if you don't enjoy operating with somebody, or if you don't like the way someone does something, you can learn what not to do. And you can see how they can fix their mistakes, as well as if someone is really, really good at their job, or if you just like being in a room with somebody. It's really easy to choose comfort in residency and just try to only go with one or two people. But you have to learn from as many people as you possibly can. You'll only be happy if personal goals vary and personalities vary. If you have someone that tells you, oh, you're only going to be happy if you go into private practice and make a bunch of money, well, that's their opinion. Oh, you're only going to be happy if you publish 100 papers a year and you have all these speaking engagements and that. Well, they're in academics. That's what makes them happy. You have to find your personal goals and use their advice to help you with your personal goals. In order to succeed, you need to do this one thing. There's never just one thing you need to do to succeed. And if someone tells you that, they're probably trying to get something out of you. So sideline projects and research projects, they can really help you or they can really hurt you. Do projects that you're passionate about. Do things that you're curious about. Don't do things just because you think you owe somebody something. Use your time wisely in residency, learn as much as you can, but also give your trust wisely to people. And here's are some impactful quotes from my mentors. So the fastest surgeon is the one that uses the least number of instruments. So the number of times you switch instruments in the operating room, that's going to make you fast. It's not how fast your hands are, it's the efficiency. What the hell are we fixing here? This is something Dr. Warren used to say in clinic all the time. when I would come out and say, oh yeah, I saw this guy, he's got pain, he needs surgery. What the hell are you fixing? And what his point was is, in a very rudimentary sense, what's your diagnosis? Mechanically, what is the problem, and anatomically, and then how are you going to fix it? So having a logical process about who you take to surgery and not just trying to fix an MRI or fix an image. Patients and their families know when they're being lied to. If you get a complication and you try to hide it from them, from the patient or from the family, and you don't own up to it, they'll find out. They know. And if you were in their position, you would know too. Being an honest surgeon is important. The smallest details missed make the biggest impacts on patient outcomes. Things that you think that you can just skip during your day, things that are small, those are the things that are going to kill people, not the big stuff. And then this was a really good one for me, especially being a revision spine surgeon, was find something you can put a name to and then continue with the case. So if you're in a redo, always work from normal to abnormal. Never just dig right into scar tissue. And I remember as a junior, I would be digging in and there'd be white stuff everywhere and I wouldn't know what was going on. Find something you can name, then go. Find something you can name. What's that thing called? And if you can't, find something you can and then work backwards. And then these are some just personal and embarrassing favorites from my mentors who I just had to throw these in here. What the blank kind of move was that? I heard that about every single day as a junior resident. I turned the bovie down to 60, one of my spine mentors. Give me that sucker. This isn't a game of tiddlywinks. I still don't understand what tiddlywinks are, but that was a term that I heard a lot as a junior resident. I assume it's not good. Someone find the blank blank bullet hole. And that's a good story if anyone wants to know about that one. That was actually here at Mayo Clinic. This was an example of extreme failure in mental and physical dexterity. That was stated during one of our morbidity and mortality conferences, which I use this phrase at home with my children all the time. Tattoos are a permanent reminder of a temporary feeling, so put it back how you found it. We cut through a lot of tattoos in back surgery. And now I just want to thank everyone who made me. I realize the irony of this picture. I don't mean just physically making me, but also making me who I am. There's a picture of me and my mom about 10 years ago, 2010. For those of you guys who don't know, my mom was a NFL cheerleader. She was a professional triathlete. She was 10th in the world for half Ironman triathlon. She made the Olympic team in 2012. She homeschooled me my entire life. So I never actually went to school. Everything that she did for me. And then the other guy who helped out was this guy, Mike Pence, also known as my dad, who bears a striking resemblance to the ex-vice president. My dad would get me up at 6 in the morning when I was 12 years old and pound me with calculus, and he was an electrical engineer. And these two people decided that they could educate me better than the school system could, not just in educational values, but also in personal values and integrity. And who I am today is really because of these two people. And to this day, they're still my best friends. And then this is a special shout out to this guy, Aaron Damon. You guys have seen him walking around here. Everything that I did research-wise, I did with Aaron. He was the right half of my brain. He was the aesthetics guy. I made some of the stuff and he was like, Bill, this looks terrible. We got to make this actually presentable. And his engineering brain and his aesthetics brain really took what we did and brought it to life. And Aaron's become one of my closest friends. We have dinner together multiple times a week. My kids call him Uncle Aaron. He's, I know, going to be one of my lifelong friends, and his friendship means a great deal to me. And then everyone knows these two guys. This is Mark Pickleman and Steve Edwards. Mark was one of my best mentors in residency. He's the one who really embodied Mayo for me for spine surgery. He was the kind of guy that you would let him take your gallbladder out, even though he was a neurosurgeon. Just everything was easy to him. And he's someone that I aspire to be like, and that I still look up to. And then Steve, everyone knows Steve. I met Steve the pirate. He's a guy that he really is a physician's physician. He's a doctor's doctor. The guy knows everything about everything. He just had his 50th birthday this weekend. And, you know, he's got the youthfulness and the energy of a much younger man, but the wisdom of a much older man. And I hope to be as mature and as dedicated as he is when I'm 50 years old. And then this is Dr. Dean. Me and Dr. Dean have grown really close over the last couple of years, and he really took over as my one of my chief mentors after Mark left. Dr. Dean, as a attending when I was a junior faculty, was the one you wanted to learn anatomy from, the one you wanted to learn spine from, because he was so open in the operating room, ready and willing to teach and to show you how he did things, explain every step. I've grown really close to Dr. Dean in the last year and a half, and he served as my mentor in my my chief year. And for those of you who just don't really understand how that works, it means that every complication that I have, every patient that I saw was under his medical license. So he was willing, as a true Mayo physician, to put himself out there to trust me with his patients. I mean, they were my patients evaluated, but they really belonged to him on paper. And for him to give me those opportunities to grow in my surgical skill and also in my my personal growth, I'm forever in his debt for that. And then this guy, everyone knows him. Dr. Q came in 2016 when I was at PGY3, took me on missions trips, really opened up the world for me from the academic side. And Dr. Q is a great coach. So he'll push you to the point of failure right before you break and then tell you you're doing a good job. And what he was able to do for me is bring out all the things that I never knew I was capable of. And he's really good at doing that for a lot of people. He's a great coach. He's been a great mentor for me in academics and how academic neurosurgery truly runs. And I'm just very grateful for him and all the opportunities that he's given me to succeed in my residency. And then again, Dr. Nottmeyer out in Atlanta Beach. But seriously, Eric's been just an amazing person. For those of you who don't know Dr. Nottmeyer really well, he's a phenomenal surgeon. He's a true physician. He's someone who passionately cares about his patients 24/7. And every second of every day that he's in the office, he's thinking about how can I make my job better? How can I make patient care better? How can I make things run smoother for everyone? He's a very selfless person. And I've learned so much from him, and I've gotten really close with him in the last few years that he's been here. And he also was a huge part in the 3D printing research that we did, not with just a little bit help with funding and things like that, but also with his emotional support and his jokes to get me through the hard times. And then just want to talk about this guy for a second, Dr. Bob Warren. He was the guy who hired me. He'll always be someone who's like a father to me. He was the person that I wanted to be as a surgeon. And I know he was only slightly disappointed that I went into spine surgery, but I hope I'm going to make him proud one day. And everyone knows what he's done for this department and what he's done for the residency. And he's one of the people besides my dad who really made me into the man I am today. And then this lovely lady who we're going on 10 years of marriage, who's given me 4 beautiful children and been there every step of every way and has experienced residency just as much as I have, who's basically been a single parent for the last 7 years with 4 children. It really is amazing how someone can make or break you in your life. And my wife has made me, and her understanding and her subconscious support of what I'm doing every day, and knowing that she's texting me, praying for me, and thinking about me has really gotten me through a lot of hard times in residency. And we've laughed a lot together, we've cried a lot together, and we've grown really close in the last 10 years. And it's been just an amazing experience. And I don't know if she logged on today. I sent her the link to the Zoom call. But if she's not and taking the kids to school, then can someone tell her that I actually said something nice about her at work? I'd really appreciate it. And then these guys, this is my daughter, Lila, the leprechaun redhead. And then my second daughter, Mackenzie. And then my son, William Elton Clifton IV. And then the youngest daughter, which looks like we adopted her from Syria, but she really just got my mom's Lebanese skin. These children have been the highlight of my life and something that I look forward to coming home to every day. And my wife has just done an amazing job with raising them. And it's been such an adventure seeing them grow up and become little people. The decision to have kids in residency was tough. I'm so glad we did it. And I'm glad we got all the hard stuff out of the way. So now that we're coming towards the other side, we can go enjoy ourselves, and I can spend more time with them and build more relationships with them. And then the last thing I want to say for all the junior residents out there and people who are just starting the journey, may the force be with you. So thanks everybody for a great 7 years. And it's been a real pleasure to be here. And it's been an honor to serve patients with you here at Mayo Clinic.
Beautiful, beautiful, Bill. I cannot even tell you that was an amazing. You saw the comments in the chat coming back and forth. And we did record it. So that way we have proof for your family that you did say something, because you're absolutely right. Your wife deserves all that and more credit. And it's just amazing what you guys have been able to do. I have a few people who want to say a few words, if it's okay with you. We have them lined up. I'm going to start with our residency directors. And maybe if you don't mind, if we can take out your screen, so that way we can, maybe we can see each other's faces and stuff like that. So I know that both Kai and Selby wanted to say a few words. Maybe I will start with Kai, Dr. Chaichanan.
Hey, hopefully you guys can hear me. I'm walking over to the Korean, but so I graduated residency in 2015. So I've seen about 6-7 residency classes go through now. Bill is one of the best, if not the best resident that I've seen. His skills are second to none. Actually second to Sanjeet though, because Sanjeet's my partner, so I can't say that. But it's quite commendable what he can do. If I had a back problem or any neurosurgical problem, I'm hoping he's near wherever he is, wherever he ends up. But it's been a true honor just to get to know him, to see what he's done, and I've learned more from him than probably I've taught him. So congratulations, Bill.
I echo what Kai said. I think that I feel the same way. I have learned more from Bill than I think that I have been able to teach him in any discipline within neurosurgery. I'm going to pivot now to Dr. Chen. Selby, go ahead.
Well, thank you, Bill, for that great talk. Bill and I actually overlapped quite a bit. So when I started my faculty position here, he was a second-year resident. So we actually grew quite a bit together, him, along his residency and me along my junior faculty track. I think he gave a great talk, and I think his talk really highlights how what you learn during residency is so much more than the technical aspects of neurosurgery. It's managing the physical, emotional, mental toll, and also building those relationships that will stay with you, the remainder of your life. I'll refer back to his timeline of his residency years. First of all, I do appreciate the reference to Tropic Thunder, great movie there. But also just, I'll say, the demarcation between learning to do your job and doing your job, it's not very clear, and you continue to learn and grow even after residency, and learn from, learn from your complications, but also enjoy your successes. I think it's important to remember that we do a lot of good in our job, and even though complications can wear you down, the end result is a lot of positive influences on our patients and on the people that we meet along the way. So just want to say thank you, Bill, for all the hard work that you've put through over the years, and you've done just an amazing job. We're all super proud of you and look forward to hearing great things about your achievements in the future.
And he continues to contribute, Bill. As you know, the work that he did, the patent that he put, is going to continue to put back into our department the work he did, through real dollars, actually, through the royalties that he's getting. That's amazing, actually. So we're very proud of you, Bill. So I'm going to pivot now to Dr. Dean. Dr. Dean, take it away, please.
Thank you, Dr. Q. Great talk, Bill. I really liked a lot of your comments, but just wanted to focus on briefly to love the nuts and bolts of your job. And I have a letter on my office wall from a urologist that I did a surgery on his wife. And it was a basic, straightforward procedure, an ACDF or something like that. had a good result. And his letter of thanks said, as surgeons, we too often focus on the complications or the very complicated cases or the bad outcomes, and we don't focus enough on the routine care we provide for patients day in and day out that has such a positive impact on their lives. So that's really for the residents and medical students as one of the key points of this job. Love the nuts and bolts of the job. Second comment is that how much Bill has built on the residencies, started for our first graduate, Dr. Yoon, and then Dr. Graywall, and now Dr. Clifton, just continuing a tradition of excellence in our residency group. And Bill, I think, has emphasized all three components of the Mayo Shield: clinical practice, education, and research, outstanding in all areas. We look for Bill to have a great year at Columbia and many achievements in the years ahead. So thank you.
Beautiful words, Dr. Dean. And I know that I love the connection and the way that Dr. Clifton mentioned the trust that you had on him and the trust that we all had on him as well. And he's how grateful he is to your mentorship and your friendship. Absolutely beautiful. Now I'm going to ask Dr. Nat Meyer, who's here as well, to say a few words. Please, Eric.
Hey, Bill, that was an excellent talk. And, when I came back to Mayo, one of the main reasons was I wanted to work with the residents and try to put some influence on them and how they practice. And you obviously have accomplished that. It's been a pleasure seeing what you've accomplished in residency. The mark that you've made on neurosurgical training with the invention of that 3D cadaver is one of the first of many marks I think you're going to make on the neurosurgery field. And so I know you're going to do very well in the Lanky Fellowship, and you're going to do very well beyond that. It's just been a pleasure watching you develop and move on to the next phase of your life.
And I love the picture that Dr. Clifton said. Was that like a real picture, Bill, that you had of, was that a shark that he was on top of Dr. Nat Meyer?
I don't know who took it. I'm still trying to find that out.
Beautiful. Thank you, Eric. Beautiful words. I'm going to ask, if it's okay, I'm going to ask Sanjeev, who spent, I think, out of all the people right here, so many days and years with you. Sanjeev, can you say a few words, please?
Yeah, Bill, I just want to congratulate you on an amazing 7 years, a wonderful residency. You've been a partner and a brother through all of it. I'm always here for you, man. I'm really proud of you, and I can't wait to see what you're going to do in the future.
Thank you, Sanjeev. Beautiful, beautiful words. I'm going to ask Dr. Lee. James, he put a few beautiful comments, by the way, in the chat, Bill. I'm trying to have, we recorded this, and I want to figure out how we're going to record all those comments also for you and your family and your children in the future when they're looking back and they're trying to understand how come they didn't see you much, when they were little. So, Dr. Lee.
Yeah, that was a very insightful talk too. I'm still trying to learn from Bill as much as I can. He's a guy who's really humble. And I just want to say some of the events that, kind of highlight like what a great of a human being he is. The first call I ever had with him, I was a patient who was like asking for opiate scripts like at nighttime around like 11 p.m. or something. And then I called my chief after he's had like 2 hours of sleep. I was like, Bill, I'm so sorry. This lady's in pain. Can you give me the scripts? And he actually drove in, and then he said, we'll drive together and get the script to the lady. And that just really goes to show how far he goes for the patients and the other residents too. I always tell him like, I want to be better than you, but hearing from other people what you've accomplished, I'm not sure if that's possible. But I hope I can be sort of a same senior for the future residents as well. And I'm gonna miss you when you head off to your fellowship. You were talking about quotes earlier, so I was thinking of some right away. One of my favorite quotes is like, "Can I get the Bovie to useful?" That's one of my favorite lines I'm gonna use in the OR. The other one is "Let's see what we got here," when he's like in the operating room, and also finally just saying "spine" out of nowhere. And Dr. Graywall's on the line. I hope he's not mad. But but yeah, I've had a great time with him, and we'll keep in touch, definitely. Yeah.
Thanks, James.
Beautiful words. And I think that what Bill, Dr. Clifton was trying to illustrate, that if every rotation that you finish, you probably have, you want to be like, I want to be a spine surgeon, I want to be a vascular, I want to be whatever the rotation. I think that shows, and I think that Bill went through that, and then eventually you find your passion. That means that you're truly successful with that passion that you demonstrate. Krishnan, I saw your beautiful comments, and I'm going to ask him to make a few comments also, so that way we can keep them recorded, so we can look back this day.
Yeah, I mean, it's crazy to see the picture of Bill starting med school, starting as an intern, and you can see the exponential increase in gray hair and the exponential loss of hair, with the final result of complete baldness. But every attending you talk to, I said essentially, be like Bill. When I was at Shands and I did my first year at UF, every attending there, when I came here and I said I was starting as a PJY2, they all told me, go be there and be like Bill Clifton. And so, Bill was a consummate professional. He sacrificed an immense amount, especially at the beginning of the year, to go out his way to teach me and James surgical anatomy, the principles of neurosurgery. And he embodied several characteristics of, like I said, meticulousness, attention to detail, and patient care. And there's several lessons, both neurosurgical and clinical, as well as philosophical, that I'll remember and I'll hope to continue towards my own journey through residency.
Thank you, Krishna. What you don't see, if you look at Instagram, he posted a picture of him when he was, I think, in medical school. And then this last year, right at the beginning, or right at the beginning of his chief year, there was also, maybe he lost some hair, got some gray hair, but he made it up with muscle bulging. So he ended up putting down some muscle. So that's good. Beautiful. Anybody wants to say any last minute words? I'm sorry that we are, so behind. I see Ricardo raise his hand. Ricardo, please.
Well, just real quick, I will always remember that time I was only 2 months here, and I will the laboratory, anatomy laboratory, and I'll go and just see whenever he's there, I'll just walk in and be like, what are you doing? What are you doing? So how he received me, and doing dissections. I remember my first birthday I spent here. I was in the lab with Bill and Aaron, and they were like, I'm like, what are you doing? And he was starting models, and he was just playing with Foley catheters and with not as bad as it sounds, but playing with materials. And he's like, oh, I'm trying to figure out this Dura. And I just sat there and didn't accomplish anything, but it was just him allowing me to be there, sit down there, do that thinking process that just taught me so much. And I'll always be thankful for all the dissections all the time, and the anatomy and everything that he taught us. And as Gaetano said, the Jeopardy sessions as well. So thank you, Bill.
Beautiful, beautiful. We're just so many legacies, so many things that you have done, Bill, that have remained and will continue to remain in our residency for many, many years and generations to come. We're very proud of you. Thank you for all your work. It's sorry that everybody, I know that there are some other meetings, but you can see a lot of people stay behind here because they want to hear you. And just hear the words that everybody wanted to say, and congratulations. So looking forward to the last few days and stuff. And hopefully they're going to allow us to do a celebration towards the end of the year. I did talk to Linda and Daniel and our team to see if we can have a celebration and bring everybody. We haven't celebrated also the amazing contributions of Dr. Warren and to the residency, and Dr. Reimer and our chief resident graduate last year, Sangeet. So we have 4 people to celebrate. So hopefully we'll be able to organize something and bring you back from New York. All right. All righty. Thank you, Bill. Thanks, everybody. Have a great day. Bye-bye.